Approximately 20 to 30% of veterans returning from Afghanistan and Iraq are diagnosed with post-traumatic stress disorder, or PTSD, an anxiety disorder marked by a wide array of life-changing symptoms, including intrusive memories, sleep disturbances, and changes in the ability to relate to family and friends. The Veterans Administration has resources to help, and staff psychiatrist Dr. David Graham emphasizes that the outlook for treatment has never been better and is improving rapidly.
Well, it seems like every couple weeks, every couple months, another medication trial is coming out, more therapies. It's not just about pills and all that, it's about getting people better. We use a variety of medications to treat the symptoms, especially to try and help people stay in treatment, and particularly the new therapies that have been coming out, prolonged exposure, cognitive behavioral therapies. There's a slew of them, and a lot of them are showing some pretty good results if we can help people tolerate the symptoms to stick with it. That's often one of the hurdles.
Technology plays a role as well. A free VA smartphone app, PTSD Coach, provides support to more traditional therapies.
Veterans themselves, typically who've been using it, have found it helpful. It helps remind them of things they may have forgotten, and especially when it comes to the relaxation and coping strategies. From a medical professional standpoint, I've talked to a lot of the psychiatrists and people doing the treatment, psychologists, social workers, PAs. Everyone thinks it's a great idea to help further education. One of the other reasons we like it is you don't have to be a veteran to download it, and you don't have to be in America. It's been downloaded all over the world. Last I heard it was at least on every continent except Antarctica so far. That helps people hopefully better understand what might be happening with them and change their mind from feeling, oh, I'm just broken, to, oh, this might be what's wrong with me, and there's places I can go to get help. To really say, hey, if you're having these problems, come get help. And that's really what the coach is also meant to. It's not supposed to replace treatment, but it's supposed to help supplement it, which hopefully will make the treatments work better.
Marine veteran Luke Pennington reviewed the app for SWN.
The assessments I really liked. I think that would be a really good idea because you're able to do that anytime you really wanted to, and it actually sets it up on it. If you can do it anytime you want, but it actually will set it up for you to let you know every month you need to redo it. And I think that's a big help.
Both Pennington and Graham acknowledge that seeking help is difficult, but VA wants to make that first step as easy as possible.
Just make a phone call or get on the internet on the VA's website, and you don't even have to give your name. You can just ask and eventually work your way into telling them who you are and giving me your information, and someone will tell you where the nearest facility is you can go to.
If they suspect some PTSD is going on, it's number one, come get help. That's what we're here for at the VA. And if you're not sure, that's why we have whole clinics just doing evaluations of, is there a problem, and if so, what's the best treatment we can get you plugged into to start getting help. That's the number one problem I would say the VAs across the country have, is getting people to realize that there is a problem and they don't have to be trying to deal with this themselves. Come in, that's what we're here for.
For more information about PTSD, visit the VA National Center for PTSD at www.ptsd.va.gov. For Military Matters, I'm Stacee Hawkins.